Are you going to need a hip replacement later in life? Here is a test that's an early indicator that you may be a candidate. You don't want that shit. So let's catch it right now and fix your shit. Start off by getting your right leg up on a chair. Now what you're going to do, from this position, you're going to flex your upper body forward, then shove your knee as far in as you can. Is that giving you a pinch right through here? If that's giving you a pinch, this is the most common site of labral tears, of FAI, of osteoarthritis. So, if that is positive, painful, tight, tender with that, here's what you're gonna need to do. You're gonna need to learn to strengthen your abductors, because the stronger these are, the less pressure is on that hip joint, and it pulls it away from the tender site. Also, number 2 is gonna be your glute max. Give it a little hop, John. Bam. Your glute max's back half, that muscle will pull that joint back into the socket to also take pressure off there. Both of those are in the hip program, which you need to enroll right now to fix your shit. Here's the second test to test if you are developing or can develop osteoarthritis in your hip. What you're gonna do is stand up barefoot. Now you're gonna bring your front of your foot up in the air like this without twisting your hips at all. Rotate your femur in as much as you can. This foot, go back to the middle, John. Your foot should go 35 to 45 degrees, just like that. But if yours is only going to here, right there, and you may be getting pain, well, guess what? You have shit to fix because you don't want that hip replacement. You need to get in the hip program. You're gonna learn to strengthen these abductors to pull the pressure off your hip joint. You're gonna learn to strengthen your glutes and to get that booty you want and to pull that hip back into the socket to take the pressure off the pain and the degeneration in the front. So get your ass in gear and fix your shit so you don't have to replace your shit.